Recently, I've received several questions about Parkinson's disease and how a patient declines, and then how to determine if the patient is ready or would qualify for hospice care. So in the next couple videos, that's what I'm going to cover, along with some suggestions for care. We know that caring for someone with terminal Parkinson's disease really requires a blend of neurological, palliative, and hospice approaches. And our focus, once they're on hospice, is always on comfort, dignity, and the symptom relief, not on the disease management. So let's move on to the specifics of Parkinson's and what you might see in a patient that's declining and ready for admission to hospice. How can you recognize this phase? These patients often demonstrate just profound weakness and immobility, where they were often able to walk, although haltingly with a walker or assist in transfers from a chair to the toilet or a wheelchair. Now they're really bound to a wheelchair or a Hoyer lift sometimes. They often have difficulty swallowing. They've got a risk of aspiration or choking. They may have stopped eating even regular foods, and now they need to be served soft foods, and even have a thickening agent added to thin liquids. You know, they could be having more difficulties in communicating clearly. The speech is delayed, slurred, and there can be significant cognitive decline too, with poor short-term memory and confusion. They may have reduced responsiveness to your conversation when you try to get them to talk, or any kind of stimulation. They appear kind of glassy-eyed, looking off, almost catatonic sometimes. They can even start having hallucinations, which is really upsetting to the patient and, of course, the family who's taking care of them, along with sleep disturbances. You know, because of the swallowing problems, there can be frequent infections like aspiration pneumonia. Sometimes they have UTIs. And of course, you can imagine they have weight loss and muscle mass reduction because they're just not moving very much and they're having trouble swallowing. So these are all the things that you would witness as you watch a hospice patient decline. But now let's look at the actual Medicare admission criteria. Just as all hospice admissions, no matter what the illness, a primary requirement is that the patient must have a life expectancy of 6 months or less if the disease is allowed to run its normal course. This determination is clinical, but Medicare provides specific functional and secondary indicators for neurologic diseases such as ALS or Parkinson's, because so much of the admission depends on their functionality. So after the primary requirement, next, Medicare looks at these things. As we discussed earlier, the patient has to show severe functional impairment due to end-stage Parkinson's, and we use a Karnofsky scale, and it needs to be a performance scale less than or equal to 40%. They're mainly in bed, dependent for most or all of their ADLs, minimal verbal communication, and they require most total assistance with feeding, dressing, toileting. They should have critically impaired nutritional status, so we want to see a weight loss of greater than 10% over 6 months, or a BMI about 18.5, and a low albumin if that's had been checked recently. And again, Medicare is going to take into consideration complications of advanced disease. So if one of the following is present, like recurrent aspiration, pneumonia, sepsis, recurrent fevers, pressure ulcers, significant swallowing problems, those are all going to really add in to allow a patient to be admitted. You know, if you're not sure, we recommend you use the frailty scale to evaluate and give the patient an actual number representing how functionally declined they are. Please see our videos regarding that if you need to review that scale and how to use it. And of course, remember the motto of our company, the Hospice Care Plan: care is treatment. And you know, that goes along with any disease process. So get our video, continue to watch get our videos and get our booklet so that we can help you with all of your care needs. And now let's look at the next video on Parkinson's with some care tips to take care of those patients as they decline. Thanks.